Typically, a visit to the dentist can be a cause for anxiety, fear, and dread. Most people don't enjoy going to the dentist, but they realize the importance of oral health and therefore make it a regular habit. This is especially true in children, as proper dental hygiene during adolescence is crucial to maintaining a healthy set of pearly whites throughout one's life. In the U.S., regular checkups and cleaning seem to be a standard for most of the population, which would seem to imply that we have some of the best teeth in the world. But how does America stack up against other countries? In order to find out who has the best teeth, we must determine who has the worst teeth. While this sounds a bit paradoxical, it makes sense. Since we cannot compare healthy teeth, we must look at the rates of tooth decay, missing and filled-in teeth, otherwise known as DMFT. For this information, we'll turn to the World Health Organization. Whichever country has the lowest rates would invariably be the one with the best teeth overall. Although the latest data is from 2003 and it's not a comprehensive list of each country, it does paint a pretty vivid picture from which one can infer our results. The study looked at two groups of people, children ages 12 and adults ages 35 to 44. In order to get a good idea of best teeth overall, we must look at which country has the least DMFT between both groups. Prior to looking into the data presented by the World Health Organization, one could naturally assume that industrialized countries would have better teeth than third world countries, as they would have better and easier access to dentists. After looking at the data, however, it seems that while industrialized nations such as the United States and Britain are very good at maintaining healthy teeth in children, the rate of DMFT increases exponentially once we hit adults aged 35 to 44. Almost every industrialized nation has a huge spike in dental cases between the two demographics. The U.S. actually has the least increase, going from a very low 1.2 to 2.4% to a moderate 9 to 13.9%. Oddly enough, children and adults in poor countries, such as those in certain parts of Africa and Asia, have the lowest DMFT. One of the most notable cases is China, which has low rates of dental issues among both groups. While there's nothing conclusive as to the reason for this, it's possible that teeth in these countries are healthier simply because children and adults have limited access to tooth-decaying foods such as soda and candy, and therefore have less decay overall. Ultimately, it seems that the U.S. is in the middle of the pack when it comes to dental hygiene. If we're going to become the country with the best teeth, we need to keep our strong oral health practices into adulthood, which includes regular visits to the dentist, no matter how anxious or fearful you may feel.